Countries around the world are adopting various COVID-19 measures in light of the new Omicron variant. But with health experts still in the midst of gathering evidence on the severity of Omicron, what public health strategies should Malaysia adopt to deal with the new variant? Immunologist Prof Sibrandes Poppema weighs in.
So what we can do, basically, or what I think we should do, is to maintain the same procedures we have in Malaysia right now. We have essentially the process that when people arrive from abroad, they will have to be tested before they come. They are tested upon arrival, and then they undergo quarantine for a week. And during that week, they get another test. And basically, that is working. And I say that because the one person that came in from South Africa and turned out to be positive was actually caught this way. It turned out that the test at the airport was positive. The student went into quarantine, and actually when he was retested, or she was retested, she turned out to be negative. That's exactly what you hoped that would happen. And also the SOPs were held well, because none of the contacts that she had, and that was a very limited number, which is another part of it, none of those was positive. So this is exactly what needs to happen, and Malaysia has exactly the right procedure for this. I don't think at the moment there are additional things that are necessary. I think we have good maintenance of SOPs, and we should keep doing that. It is not a time for relaxation, but it is also not a time for stricter measures.
Poppema said the country should not take drastic measures, but focus on improving genomic sequencing to detect new COVID-19 variants in the future.
With Delta, actually, it had spread very widely before we even realized it. This time, South Africa has given us very early warning. So it's still in the beginning. That is also why there's not a lot of data available, not even in South Africa, and certainly nothing elsewhere, because in no other country there's been cases around for, let's say, more than 2 weeks. So we don't have that information. Now we have early warning, and really I think that that's the important thing. So what we should do in the future is keep sequencing cases of COVID. That's true for cases that are coming in from abroad. That's also true for cases in the country. So the most important measure we can take in terms of public health is monitoring, sequencing cases when there are cases that have new mutations, analyze those, make sure that those are not ones that are more infectious or more likely to escape from vaccination.